Body therapy is relevant and useful as part of or in addition to trauma recovery work. Well, really anything can be a good adjunct as individually applied. Some people will get great benefit out of Feldenkrais. Some will get, and some people won't. Some people will get wonderful result from yoga, and some people won't, etc., etc. Osteopathy, yes and no. The main thing to be cautious of when you go yourself to a body therapy, cranial sacral, Rolfing, osteopathy, any of these, is to, and any of them, always pick the practitioner very carefully and interview them and talk to them about how they work and their philosophy, because there are a lot of body workers who think that they're trauma therapists, and they're not trained in trauma therapy, they're trained in body therapy.